And welcome. We're busy now with episode number 10 in ADHD. Okay, let's get cracking. Your child's role in the treatment. Child also has an important role to play, When they're old enough, children with ADHD should play an active role in managing they must take care of their own health as well. This might look like they must ask questions and offer opinions at doctor visits. They must encourage them to be confident. They must ask questions because it's their life at the end of the day. You as a parent can't be with them all the time. They must take a role in taking the medications on time. They must help decide on special arrangements they need in the classroom. So please encourage your children to talk and open up. Complication of ADHD in children. If it goes untreated, then you have lifelong complications, which can be substance abuse. You can get into drugs, alcohol, drinking, trouble getting a job, holding a job, eating disorders, maybe overeating or maybe undereating, anorexia. Other mental issues, they may get depression, anxiety, unstable relationships. They may not be able to get boyfriend, girlfriend. They won't be able to keep it long. Poor academic performance, risky behaviours. They'll drive wildly with the car, get upset, stressed out, insomnia, finding it difficult to sleep at night, a lot of other problems. So disciplining with regard to not disciplining, having a structure with ADHD children. The children with ADHD, as we mentioned, need a structure. It is often hard for them to regulate their own behavior, so they need adult supervision to say this is right, this is wrong. Because they do not have the executive function to make decisions on their own, adults have to tell them do this and don't do that. That's part of behavior modification. That means set clear boundaries, what's acceptable and what is not acceptable. And if they do something good, praise them. Please praise them. Positive feedback is important, so the behavior can become more disruptive when the interaction with adults are negative ones. So praise the positive behaviors. Don't lose your temper. If you lose your temper, it's going to make things worse, and punishment is less effective as well. Some things that can help, you can do some things that can help. Create both verbal and written expectations. Write it down and talk to them, because some people are visual learners, they think with the right brain. Others are logical learners, they think with writing. So do it in different forms of communication. A post-it chart that lists your child's responsibility. Post a chart so you can read and tell them verbally so they can hear it as well. Make rewards immediate. So if you do something nicely, do it now. Don't say at the end of the year, at Christmas, I'll buy for your bicycle or buy for your cell phone at the end of the year. End of the year, child, because he doesn't have executive function, he can't think as far as Christmas, or he can't think as far as Eid. So you got to say, you got to do it now. If you do something now, let's go buy a pizza, or let's go get a chocolate, or you can have a half an hour break for TV. So the reward has got to be immediate, so the response is immediate. Be clear about consequences and enforce them right away, but do so calmly. Do it calmly. They must know that this is not acceptable. Remain supportive and encourage them even when you need to correct the behavior. Keep encouraging them, but make it clear that if certain behavior is not acceptable, then be clear about it. But please remember, there are many children with ADHD who are very sensitive to criticism. So please do it diplomatically, do it with compassion. Should you give time out? When a child becomes very disruptive, yes, a time out is very important. You just say time out, time out, time out. Okay, guys, stop. Give a 1 minute. Children, just give them 1 minute break. Just say, or go sit there at the corner. We must have a specific area in the house. We must say, okay, that corner has a negative feeling. So just go sit at the kitchen table for 1 minute and you time yourself. All right, 30 seconds left, 20 seconds left, 10 seconds left. All right, you can come back. And there must be discipline. Focus on it. Say 10 minutes, go to the kitchen and sit there. And I don't hear any noise. Everyone must be quiet. Time out. You must have time out. And you measure the time and you give them a signal. 50 seconds, 40, 30, 20, 10. All right, 5, 4, 3, 2, 1. Okay, come back, and then come back again. So you must tell them precisely, this is time out, this is not acceptable, and they must follow that. So stay calm. If you tell them to go out timeout and they ignore you, then add another minute. So you tell them, all right, if you're not going to go at a timeout, then you're going to go for 2 minutes. And if you're not going to listen, then it's going to be 3 minutes. And then if you're not going to listen, okay, then I'm going to take your pizza away for this weekend. So those type of things. So it's got to be done gently. You know your own kids. Give a consequence that's meaningful to them, such as, okay, because you did, there's no video games for the rest of the day. So then they know, okay, next time I won't do that, because now you must know what their favorite thing is. To say, okay, now there's no more video games for you for the rest of the day. So then I say, oops, I did something wrong. So tomorrow they'll think again. Okay. But do it calmly. Practice timeouts. So initially practice with the kid. Make it a fun game. Say, hey kid, we're going to practice what is a timeout. He'll say, what's a timeout? You say, okay, let's practice it. So you do it the first time just as a fun game. You say, look, whenever I need space, and I'm going to tell you timeout, you must run to the kitchen, I must sit there for 1 minute, I'm going to time. You say we'll make it like a game of hide and seek. So the kid will be excited. Oh, make it a game of hide and seek. You say, yes. So let's practice timeout. So you tell the kid, oh, run to the kitchen, the kid will run to the kitchen. So, okay, stay there, don't come, and then you count 1 minute, then you come back again. Right, now, then you tell the kid, okay, next time when I say timeout, I want you to run to the kitchen, and you don't come back until I tell you. So now that you've conditioned it in a positive way, so the kid doesn't think that the timeout is a punishment. Now the kid looks forward to the timeout as if it's a game of hide and seek. So you got to use psycho on the kids to do it gently, so then they appreciate it, that we as parents are going to do the best for them as children. It's a teamwork effort. So make sure you're reinforcing good behaviors so that they understand the difference. For example, if you put your child in timeout for hitting the sister, but if you praise them earlier, so they got to know the clear boundaries at what is right and what is wrong. Important to remember, ADHD does not mean that your child is mental health. Don't think that the child is crazy. It just means it's a neurodevelopmental disorder. Let's remove the stigma. Let's not say, hey, that kid is crazy. Let's not do that, please. Let's not do that, okay? It's like how different children have got different milestones. I mean, the kid with the ADHD, autism, as what I mentioned, so they are brilliant in other areas of the brain, and we need to focus on the areas that they're brilliant. If we don't do that, they're going to go into depression, anxiety, personality disorders, OCD, and all those type of things. Okay, so that's the end of today's session. So just to focus, today's theme of today's session, focus on being positive with the child, reward the good behavior, but do the reward immediately. Don't wait for later. Stay well, look after yourself. Alhamdulillah.